Hi, this is Ricky Mott, Director of Undergraduate Recruitment at Massachusetts College of Pharmacy and Health Sciences. I'm pleased to introduce John Fanikos, who graduated from MCPHS Boston with a Bachelor of Science in Pharmacy in 1984 and is currently the Executive Director of Pharmacy at Brigham and Women's Hospital. As a research pharmacist, he's worked extensively in investigational pharmacy, anticoagulation, and thrombolism. He's a past president of the Massachusetts Society of Health System Pharmacists and serves as an adjunct professor of clinical pharmacy practice at MCPHS University. We're thrilled to welcome John as our keynote speaker to accepted students at MCPHS. John?
Thank you, Ricky. First of all, let me welcome all the students to Massachusetts College of Pharmacy. Let me welcome the parents to Massachusetts College of Pharmacy, and let me welcome the family, the siblings that may be arriving to the MCPHS campus, to our Longwood medical area, which is internationally recognized for its contributions in healthcare, and then finally to the city of Boston, our wonderful city on the East Coast, in the Northeast and part of New England. Let me take a moment and just first congratulate the parents. I've had 3 children. I've managed to get them all into college. They've all finished their undergraduate and in many instances their graduate degrees. And I know it is no small task to get your students through grammar school, through high school, to take a whole series of examinations, to fill out the Common App, the financial aid forms, and then finally to sit and wait for the acceptance letters that come through from the different colleges and universities that your child may have entertained. So congratulations on doing something that I think is incredibly right, because I've sat in your seat and walked in your shoes. For the students that are here today, congratulations. This represents yet another crossroads in your life. I talked about grammar school and high school, and now you're graduating into the major leagues, if you will, joining the college to become an adult, and more importantly, to become a professional in the healthcare industry. So congratulations. I don't think you could be in a better place. I'll talk about that in a minute, and I don't think you could be in a better institution and in a better city. I'm a pharmacist by training. My career path has been pretty easy. I come from a family of pharmacists. My dad's a pharmacist. My brother is a pharmacist. We're an incredibly boring group around the holidays, if you hang around with us. But after working with my dad and my brothers, that I learned very quickly that I enjoyed the business of pharmacy, providing health care for the community, and it became very easy for me to find that I knew that attending the College of Pharmacy was in my future. For those of you who may have some second thoughts or trepidations about entering into the healthcare, I'd urge you to go through your experience. If this is your first year in college or in the university setting, there are lots of different subspecialties in healthcare. There are lots of different disciplines. And while something like ultrasonography may all of a sudden not be an area of interest for you, there are other areas in things like pharmacy, nursing, radiology, physical therapy, dentistry that may all of a sudden attract your attention. So I think it's important that you're in a setting of healthcare, and I think this is an industry that is never going to stop. And if anything, that is demonstrated by our situation today. If you're dealing with the COVID virus. So my career path is, I think, has been easy. For those of you that are joining the university, again, keep your eyes open, keep your ears open, and there are many, many different areas in healthcare where you can make contributions and you can make a career. I work at Brigham and Women's Hospital. We're an academic medical center that has been at the forefront of providing health care. We provide every scope of care from routine events like childbirth to life-saving interventions like organ transplantation. We were the first organization or hospital in the world to complete the first successful kidney transplant. Now we do both kidneys, lungs, hearts, and bone marrow, and it's a common practice. But the facility itself and this area of the Longwood medical area has a number of hospitals that are nationally and internationally recognized for their expertise in not only delivering routine care, but being on the cutting edge of introducing new drugs, new devices, new procedures that improve people's health and extend their lives. So I think you're in a great spot because you're in the center of all the activity in terms of medical advancements that you could possibly find not only in the world, but I think in the universe. Let me also add that within this area of intellectual advancement, there are a number of companies as well, both in the device industry and in the pharmaceutical industry, that is moving advances forward for the treatment of disease. So we have our own laboratories here in the Longwood medical area, but you simply have to go across the river to Cambridge, and you'll find that there is a whole host of both massive pharmaceutical industries, small pharmaceutical industries, massive drug companies or device companies, and small device companies. And so not only are you in the hub of activity in the Longwood area, but there is lots and lots of activity within the city of Boston and in the areas of Cambridge that are making advances in healthcare. And there are all kinds of contributions that you can make. So being exposed to these world-class organizations should become part of your education here at the college and as part of being in the community of Boston. It is all around you. Take the opportunities. Don't wait for invitations. Find your way into these organizations and be an active participant because they will need your help. I think if you look across the students that are at the college right now, you will find that many of them have been engaged in full-time, part-time, periodic employment, both in the hospitals that are here, in our organizations like drugstores, but also in individual laboratories and in different companies. So there is lots of opportunity here, not only to be an academic student, but to embrace other opportunities to be part of the fabric that is developing and delivering health care in the Boston area. Don't miss out on that. And let me also say that you're in one of the greatest cities in the world. Boston is not a massive city, it's not a tiny city, but it's somewhere in between where you can make connections with different people, not only in your college, but outside of the college, and there is an opportunity to enjoy many of the aspects that the city of Boston has to offer. You can go down to the Charles River and hear the Boston Symphony Orchestra playing for free. At certain afternoons, you can go down to the Museum of Fine Arts. There's free admission for the general public after 5 o'clock. Don't miss out on many of the things that the city of Boston has to offer. It's a unique opportunity. Finally, I want to also say that we are in an era of multidisciplinary, interprofessional patient management. So you are expected, no matter what discipline you are participating in, pharmacy, dental hygiene, nursing, radiology, ultrasonography, that you bring something to the party. And so the team approach now of taking care of patients is very much evident in many of the facilities that you will interact with. So the expectations are is you are going to be an active participant. As a student, I urge you to be an active participant in class and to be an active participant when you are introduced to healthcare professionals. They are expecting you to play a role and to bring your expertise. It's important that you contribute to patient care in terms of the advancement of healthcare delivery in the model that we're following here in the United States. So let me summarize. First of all, congratulations for your acceptance and welcome to this family of colleges, to the university and to the colleges and universities within the Boston area. I don't think you could have picked a better area for your future. I don't think you could have picked a better area in terms of professional opportunity and growth. And I hope you enjoy your experience not only today, but in the time that you're at the college. Thank you. Good luck.